7 medications that can damage your kidneys. Welcome back to the channel. Today, we're diving into an important topic that affects many of us. Medications that can harm your kidneys. These vital organs work tirelessly, filtering waste products from your blood and regulating essential bodily functions. It's crucial to be aware of potential harm that common medications can inflict upon them. Make sure to watch till the end to stay informed and protect your health. We're kicking things off with a common culprit, NSAIDs, or non-steroidal anti-inflammatory drugs. You know them, you might even have some in your medicine cabinet right now, ibuprofen or naproxen. These are household names for many of us. They're lifesavers for headaches, muscle pain, and period cramps, right? They can make a world of difference when you're in discomfort. But here's the thing. NSAIDs work their magic by reducing inflammation, and a side effect of that is they can also reduce blood flow to the kidneys. This reduced blood flow can be problematic. Now, for most healthy individuals, popping an occasional ibuprofen for a headache isn't a big deal. It's a quick fix that usually doesn't cause harm. Your kidneys can handle it. They are resilient organs capable of filtering out waste and maintaining balance in your body. But, and this is a big but, if you're taking NSAIDs regularly, especially at high doses or for a long time, it's like flashing a yellow light at your kidneys. This is a warning sign that shouldn't be ignored. Long-term frequent use of NSAIDs can increase the risk of a condition called analgesic nephropathy, which basically means kidney damage from painkillers. This condition can be quite serious. Symptoms might not show up right away, and that's the scary part. You might feel fine while the damage is quietly occurring. You could be harming your kidneys without even realizing it. The damage can be insidious and progress over time. So, what's the takeaway here? It's crucial to be mindful of your kidney health. First and foremost, always talk to your doctor before starting any new medication, even over-the-counter ones like NSAIDs. They can provide guidance tailored to your health needs. They'll help you weigh the benefits against the risks and find the safest option for you. This personalized advice is invaluable. Secondly, if you're dealing with chronic pain, don't just rely on popping pills. There are other ways to manage pain effectively. Explore other pain management strategies with your doctor, like physical therapy, hot or cold therapy, or even alternative medicine approaches like acupuncture. These methods can be very effective. Your kidneys will thank you in the long run. Taking care of them now means a healthier future. Let's talk about antibiotics, those tiny pills that pack a powerful punch. These medications are lifesavers when it comes to battling bacterial infections, often turning the tide in our favor. But like any powerful tool, they need to be used responsibly to avoid unintended consequences. Some antibiotics, particularly a group called aminoglycosides, can be tough on your kidneys, causing more harm than good if not monitored properly. Aminoglycosides, which include drugs like gentamicin and tobramycin, are potent antibiotics often used for serious infections that don't respond to other treatments. While effective, they can accumulate in the kidneys and potentially cause damage, especially in people who already have some degree of kidney impairment or other underlying health issues. Now, this doesn't mean you should avoid antibiotics altogether. They are essential in treating bacterial infections and can be life-saving. When you have a bacterial infection, you need to take antibiotics to fight it off and prevent it from spreading or worsening. However, it's crucial to have an open conversation with your doctor about the potential risks and benefits of specific antibiotics, especially if you have any pre-existing kidney conditions or other health concerns. Your doctor can monitor your kidney function through regular blood tests while you're on these medications, ensuring that your kidneys are handling the treatment well. This helps them adjust the dosage or switch to a different antibiotic if necessary to minimize the risk of kidney damage. Remember, communication is key to effective treatment. Be your own health advocate and ask your doctor about the potential impact of any medication on your kidneys. Stay informed and proactive about your health. Next up, we're tackling a class of drugs that many people rely on for heartburn and acid reflux proton pump inhibitors, or PPIs for short. These medications have become a staple in many households due to their effectiveness. You've probably heard of them: omeprazole, lansoprazole, esomeprazole. These are some of the most commonly prescribed PPIs, and they are widely available both over the counter and by prescription. They're incredibly effective at reducing stomach acid production, providing much-needed relief from those burning sensations. For many, they are a lifesaver, allowing them to enjoy meals without the fear of discomfort. But here's the catch: long-term use of PPIs has been linked to a few potential kidney issues. This is something that has raised concerns among healthcare professionals and patients alike. Studies have shown a possible association between long-term PPI use and an increased risk of chronic kidney disease and even acute kidney injury in some cases. These findings suggest that while PPIs are effective, they may come with some serious risks if used for extended periods. The exact mechanisms behind this link aren't fully understood yet, but it's thought that PPIs might trigger inflammatory responses in the kidneys or interfere with certain processes that keep these organs functioning optimally. Researchers are still investigating to fully understand how these medications impact kidney health. Now, before you panic and toss out your PPI prescription, remember that these risks are generally associated with prolonged use, often over several years. It's important to weigh the benefits and risks with your healthcare provider. If you've been taking PPIs for a short period as prescribed by your doctor, you're likely in the clear. Short-term use is generally considered safe and effective for managing acid reflux and heartburn. However, if you've been relying on PPIs for an extended period, it's a good idea to have a conversation with your doctor. They can provide personalized advice based on your medical history and current health status. They can help assess your individual risk factors, consider alternative treatment options like H2 blockers or lifestyle modifications, and determine the best course of action to protect your kidney health. It's always best to make informed decisions about your health in consultation with a professional. Chapter 4. Antivirals fighting viruses, protecting your kidneys. Let's talk about antivirals, the medications we use to combat viral infections. While generally safe, certain antivirals, particularly some used to treat HIV, can potentially affect your kidneys. HIV medications are essential for managing the virus and improving the lives of people living with HIV. However, some of these medications, especially older ones, can put a strain on the kidneys. It's important to remember that everyone responds to medications differently. What might cause kidney issues in one person may be perfectly safe for another. That's why regular monitoring and open communication with your doctor are crucial, especially when it comes to medications that can potentially impact your kidneys. If you're taking antivirals, your doctor will likely monitor your kidney function through regular blood and urine tests. This helps them catch any potential problems early on and make necessary adjustments to your treatment plan to minimize risks. Chapter 5. Diuretics, balancing blood pressure, protecting your kidneys. Let's talk about diuretics, also known as water pills. They're often prescribed to manage high blood pressure, heart failure, and other conditions where fluid buildup is a concern. Diuretics work by helping your kidneys flush out excess water and sodium through your urine. Now, while diuretics are generally safe and effective, it's important to be mindful of their potential impact on kidney function, especially when used long-term or at high doses. Here's why: diuretics can sometimes alter the balance of electrolytes in your body, including sodium, potassium, and calcium. These electrolytes play a crucial role in maintaining proper kidney function, and imbalances can sometimes lead to kidney problems. The good news is that these electrolyte imbalances are usually manageable with careful monitoring and adjustments to your medication or diet. Your doctor will likely monitor your electrolyte levels through regular blood tests, especially when you first start taking diuretics or if your dosage is adjusted. Chapter 6. Chemotherapy, fighting cancer, protecting your kidneys. Chemotherapy. Drugs are powerful tools in the fight against cancer. They work by targeting and destroying rapidly dividing cancer cells. However, some chemotherapy drugs can also damage healthy cells in the process, including those in the kidneys. Chemotherapy-induced kidney damage, often referred to as nephrotoxicity, can range from mild to severe. It's essential to be aware of this potential side effect and take steps to minimize the risks. The good news is that doctors and researchers have made significant strides in developing chemotherapy regimens that are less toxic to the kidneys. Additionally, there are supportive care measures such as intravenous fluids and medications to protect kidney function that can help reduce the risk of damage. Chapter 7. Lithium balancing mood, protecting your kidneys. Lithium has been a cornerstone of treatment for bipolar disorder, helping to stabilize mood swings and improve quality of life for countless individuals. However, it's crucial to be aware of lithium's potential impact on kidney health. Lithium is primarily processed by the kidneys. While generally safe when used as directed and monitored closely, long-term lithium use can sometimes lead to kidney issues in some individuals. The key to mitigating these risks lies in regular monitoring and maintaining appropriate lithium levels in the bloodstream. Your doctor will likely order regular blood tests to check your lithium levels and kidney function. Outro: stay informed, stay healthy. Thanks for watching. If you found this video helpful, don't forget to like, subscribe, and hit the notification bell so you never miss an update. Stay healthy and see you next time.